Hello everyone, this is the Week in Review. Here's a look at what we've been up to. In observance of Caribbean Wellness Day 2024, the Ministry of Health's Disease Control Non-Communicable Diseases Department held a fitness walk on Saturday, September 21st, geared towards raising awareness of health and wellness practices while improving cardiovascular health. The walk saw scores of persons from across the health sector and other partnering agencies. Minister of Health Dr. Frank Anthony, who also participated in the activity, during remarks highlighted that diabetes and hypertension are still significant public health issues in Guyana due to unhealthy lifestyle changes and dietary habits. With aims to cultivate healthy lifestyle practices, the minister disclosed that the ministry will be hosting a series of other fitness walks to encourage persons to adopt healthier habits.
There are literally thousands of people who got high blood pressure. Some of them have been able to control it, others who have not been able to control it. We have thousands of people who got diabetes, and we have the same thing. But if we want to get people healthier, then we need to get them to exercise, we need to get them to eat the right things.
Later on that day, the minister attended the graduation ceremony for healthcare workers who completed their master's certificate in healthcare and physician leadership. This program was undertaken as a collaborative effort between the Ministries of Health and Public Service, York University, and the Schulich School of Business Executive Education. During his featured remarks at the graduation, the minister gave an overview of some of the major infrastructure investments in the health sector.
By the end of the first half of 2025, we'll have 6 new hospitals operational. And by the end of 2025, we want to bring another one into operation. That's the Maternal and Child Health Hospital. So by next year, certainly, we'll have 7 new hospitals that will be operational.
That evening, the minister also bid farewell to the 19th team of specialist Chinese doctors who have provided vital medical services within Guyana's healthcare system for over the past year. Their efforts have significantly contributed to enhancing specialist care across the country. During his keynote address, the minister had this to say.
We are very pleased with the work of the 19th Chinese Brigade and all the other brigades that came before. But I think what we have seen over the last couple of years is that the doctors who come have been taking on more and more responsibilities.
This Chinese brigade was presented with certificates and plaque in recognition of their outstanding contributions. Dr. Frank Anthony is currently in New York attending several meetings at the 79th United Nations General Assembly. On September 23rd, he attended and delivered remarks at the 3rd annual meeting of the UN Groups of Friends to eliminate hepatitis. Dr. Anthony, in his remarks, reminded the audience that hepatitis disease, in its various forms, remain a silent, potent public health threat globally. The health minister, in his core speech, advocated for policies and strategies governing the need to prioritize access to testing and treatment for hepatitis, affordable hepatitis medication, and elimination of stigma associated with this disease. That same day, he also attended the Global Health Task Force meeting. Meanwhile, on September 24th, the health minister participated in the 3rd gathering of Global Group of Heads of State and Government for the Prevention of NCDs. On Thursday, September 26th, at the plenary segment of the high-level meeting on antimicrobial resistance, the minister, Dr. Frank Anthony, urged governments to utilize their new political declaration to collaborate in creating a future where antibiotics remain effective, where infections can be treated successfully, and the health and well-being of all people are safeguarded. He also emphasized that the AMR crisis transcends borders, stating that it does not discriminate between the developed and developing nations. It is a problem of global proportion that demands an international response. This wraps up our Week in Review. Thanks for joining us and stay tuned for more updates. Eligible persons are reminded to visit their nearest health center to access the eye testing and spectacles voucher and the cervical cancer screening voucher. Your health matters.